Welcome to Break the Rules with Dr. Lauren Lax, a podcast dedicated to quieting the noise in the health, food, and fitness world. Dr. Lauren is a leading nutritionist, therapist, and functional medicine practitioner on a mission to help others thrive in their own lives, mind, body, and soul. And now, your host, Dr. Lauren Lax.
Well, hello. Welcome to another edition of the Break the Rules podcast, where we talk about quieting the noise in the health, food, and fitness world. And today I've got Dr. Quinn, Medicine Woman, on the show, which was one of my favorite shows growing up. But Dr. Quinn is in the house, and Dr. Quinn is a specialist in regenerative medicine, which sounds really cool in theory. She's going to be explaining to us today what that's all about. But she is a board-certified Physical Medicine and Rehabilitation specialist, and has specialty training in regenerative medicine, functional medicine, and aesthetics. And her background as well, just orthopedic, helping people rehabilitation. With rehabilitation is how she got started, and then found the lovely world of functional medicine, helping people get to the root causes of multiple issues. She has extensive experience with athletes of all types, in particular, professional and amateur. And she enjoys helping her patients today feel and look better by working closely with them and focusing exactly on their goal, what their goals are, and then helping them figure out the right modalities, treatments, IV therapies, aesthetics, bioidentical hormones, and beyond in her practice. She's just pretty much a badass. And Dr. Quinn, thanks so much for coming on the show, talking about some regenerative medicine, which I know is near and dear to your heart. But give us a little bit of background first about who you are and what got you doing the work you were doing in the world.
Yeah, I mean, I'll try to be brief. Can be a long story, but so I found physical medicine and rehab. I wanted to be a doctor my whole life. And when I was in medical school, fell in love with physical medicine and rehab. And what physical medicine and rehab is the study of anything that makes you not move normally. So, I mean, from orthopedic injuries to spinal cord injuries to brain injuries, rheumatologic conditions, neurologic conditions, anything that physically makes you not move normally. And that was near and dear to my heart, just growing up in athletes. I could sympathize with kind of movement disorders. And so that's how I got into that field. And then once I was out in practice, I did a lot of sports medicine and pain management, just traditional medicine. And while I really loved doing that, it didn't quite feel like it was my calling. And I heard about regenerative medicine, which I'll go a little bit more into detail in a minute. But I had heard about regenerative medicine while I was in residency. And what regenerative medicine is really essentially using your own body to help heal itself. So we take some of your cells, whether it's your platelets or your stem cells, and we stimulate your natural healing process within yourself to regrow tissue. And that made sense to me. And so we didn't learn it in residency, but I ended up finding a mentor when I was already in private practice, told him to hire me, and he did. And he taught me even more about regenerative medicine and also introduced me to the world of functional medicine. And so that's kind of the path that took me to where I am today.
Very awesome. And so once you found this path, what did that look like learning that? And then explain to us, just layman's terms, what regenerative medicine really is in practice, what that looks like as a physician working with individuals and the types of therapies that may entail.
Yeah, I mean, the world of regenerative medicine is pretty vast. So again, regenerative medicine is really stimulating your body's natural cells. So the goal of all of regenerative medicine is really, I come from more of an orthopedic style background. So I began using it to help prevent and or delay the need for orthopedic surgeries, anything from rotator cuff tear, meniscus tear, total knee replacement, things like that. I mean, I'm trying to avoid patients, decrease the need for patients of getting surgery. Regenerative medicine is also used. I mean, I do regenerative aesthetics. So now we can use your body's own cells to help stimulate collagen formation and regrow tissue that way. It's used in many areas of medicine now, but it really is focusing on stimulating your body's innate healing and innate growing to repair injured tissue and, feel and look younger.
And with that, what would you say are like some of the most common pain points people are come to you with that, like, are they looking for regenerative medicine, or it's like, here's the pain point and then this is what can help you?
Yeah, I guess it's kind of 50-50 in my practice. A lot of people, I mean, regenerative medicine is very big in Colorado because we have probably the most active state in general. So we have a lot of sports medicine physicians out here, and a lot of patients are very well versed in the different types of treatments. So I'll have a patient that comes to me. I'm an osteopath, so they'll come to me, because I'm a physical medicine and rehab doc, or because I'm an osteopath, and they think I'm more open-minded, or whatever the case may be. And with my extensive training, I can offer them, your standard. We can do manipulations. I can send you to physical therapy. I could do a steroid injection. I could do platelet injections, or I can do stem cells. So some people don't know that I offer kind of that whole realm of treatment or have the ability to do those. And some patients come to me because, the name of my practice is Core Regenerative Medicine, and they know what regenerative medicine is. And they say, hey, I just talked to a surgeon. I have a meniscus tear, and they said, the only thing that they can offer me is surgery, and I don't want surgery. Or they said, my knee arthritis is so bad, it's a knee replacement or nothing. What else can you offer? And so people come from all different places, but most of the time, my patient population is really trying to avoid surgery.
Okay, so avoiding surgery, typical like shoulder or knee or hip kind of surgery. What do you see a lot of?
Again, so meniscus tears, rotator cuff tears, labral tears, persistent ankle sprains, arthritis in your fingers and toes, and then any sort of joint replacement, knee replacement, shoulder replacement, hip replacement. People will come to me to try to prevent that. And, sometimes, I had a patient this morning who came to me who broke their hand actually and said, I don't want surgery. And I looked at him and I said, surgery is the only option. And so, what I can provide to patients is I have a very honest, I'm not trying to push one agenda or the other. I sent him away and said, I couldn't help him. You need to go see a surgeon. And there are other patients that I can help, and so I think the benefit of, seeing myself, is that I am well trained in physical medicine. So sometimes I do just refer patients to physical therapy first, or sometimes, an injection, stem cells are appropriate, or sometimes surgery is appropriate. And so I think coming here specifically, I have a very, wide depth of knowledge, and I'm not, again, just pushing one thing that I do or the other. I really, truly want to help patients avoid surgery if possible and get better and, get back to living, honestly, a life they love or doing the sport they love as soon as possible. Because regenerative medicine, the other advantage of regenerative medicine is not only are there very few side effects because we're using your body's own tissues, you're pretty much going back to your sport depending on the level of athlete that you are. Within 1 to 6 weeks. So there's minimal downtime from your sport, and there's no lost time from work. So you're not losing money that way. There's local anesthesia, but you're not put under for the procedure. So you're, walking out of here, you're in pain for a few days after the procedure, but you're not bed bound, so there's so many advantages of doing regenerative medicine over surgery when it's appropriate.
I would love to hear some really like client success stories that you've seen, or just really people that maybe didn't feel like there was much hope beyond like what they're struggling with.
Yeah. That's a good point. I'm trying to get more of my patients on YouTube for testimonials, which I have one really good one right now. But his story, or honestly, so I did my husband. And for those of you in medicine, you know that you rarely work on your spouses or your family members, just because I never want that. Well, I would never do anything in my office that I wouldn't do to my family members, but it's just a higher degree of, I don't know the word I'm looking for, but it's, scary to work on a family member. It's scary to work on all patients, but just in case something goes wrong, then it's your family member, right? But my husband has torn his ACL twice, has a persistent meniscus tear, had a partial meniscectomy already, but was just having knee pain. And he's a very high level athlete. And so, I said, you really should do stem cells. Let's just do it. And how I do it in my office is I am getting into your bone marrow. So, it's a 2-3 hour procedure. I'm getting into your bone marrow. I'm taking some bone marrow out. I'm sometimes getting your fat as well and processing it and then injecting it into the area. And so we did it to my husband. We injected his knee directly, I do it ultrasound guidance. You can see the meniscus tear on ultrasound, and the needle went right into the meniscus tear, put some stem cells and some platelets in there. And that was that. And he did great. And then about 5 weeks later, so I like to do my procedures in a series of 3. I do stem cells the first time, and then I follow up with about a month later each with 2 platelet-rich plasma injections. And what the platelets do is stimulate the stem cells, kind of wake them up and stimulate more tissue growth and healing. So the second time I went in there about 5 weeks later, I was ultrasounding his knee to do the platelet injections. And I had a really hard time finding that meniscus tear. And I mean, so eventually I found it, and you could see where the tear was, but it was filled in kind of light gray. I mean, I can't even tell you how cool it was, because it's really hard on ultrasound to re-simulate an exact picture, because it's such a, I mean, you move that ultrasound even just a little bit and the picture looks different. But I was looking so hard I wanted to see that tear again. And I did not think I would see healing in 5 weeks' time. And it was so healed. Like, I was ecstatic. I'm still ecstatic. And then, because my husband, we didn't do this kind of second follow-up injection until a year later. And I mean, that summer he went on to win some mountain biking races he was in. He still has no knee pain. And he started having knee pain this past year. And I was like, well, let's do that other PRP injection. And again, went in there and saw even more healing. I mean, it was very difficult to see the meniscus tear at all, which is just cool, because you rarely get to see follow-up pictures like that on imaging. So, I mean, that's one success story. I had another, and you might be thinking like, oh, that's her husband, he's just going to say that he feels fine. But I actually think it's the opposite. My family that I've treated tend to be my most critical.
Right.
So I don't think he would just tell me that he feels better. Plus, I can see the degree to which he's exercising and not having pain. And so, I don't know, that's cool. I mean, there's so many. I had a patient, this is actually a really good story. So I had a patient, veteran, come in, and he was walking with a cane, and he was told that his only option was a knee replacement. And he was, I think, in his 70s, and he couldn't afford to do anything. And so I elected to do his procedure for free at the time. And we did stem cells. And literally 2 weeks later, I kid you not, 2 weeks later, he walked into my office without a cane, in tears, saying he never would have even seen a doctor if his knee felt this good. And that was just like, it was so cool. I mean, 2 weeks, 2 weeks would be the earliest anyone gets better. Usually it's 6 to 8 weeks, because you're stimulating healing, and that takes time. But I mean, he literally, like, when he walked into my office without a cane, and he had walked into my office 2 weeks before with a cane and was in pain after his procedure and all that. I mean, it was amazing. It was just like the coolest. I should follow up with him, but he was very grateful.
Yeah, see how he's feeling today. That's awesome. I'm sure that was really game-changing.
Yeah, it's just, when you see it that stark, I mean, not everybody feels better in 2 weeks, but, when you see someone walking with a cane and then they're not, I mean, that's evidence of success. That's not just subjective,
Before and after. Explain to folks what stem cells actually are and like how they work.
So I'm gonna explain stem cells and platelets, because they go together. So stem cells are the worker bees in your body. There's stem cells all over your body, and there's different levels of stem cells. So if you think of stem cells in terms of maybe like a baby, and then, babies grow up and they become toddlers, and then you have, kids, and then teenagers, and then adults, right? And so all of those stages until they become adults are stem cells. They're different levels of stem cells, right? So maybe a baby doesn't know yet if it, or a kid doesn't know yet if it wants to, be a soccer player, or what it wants to be when it grows up. And then, a teenager, knows it wants to be an athlete, but doesn't know maybe what kind of sport. And then by an adult, you either picked a career or, a sport or whatever. And so that's kind of the same as stem cells, depending on where they're found in the body. Stem cells found in your bone marrow or your fat or even your blood, their stem cells are kind of more like a baby or a toddler, where they don't know what they want to be yet. But there are stem cells in your body that exist in your bone that already know they're going to be bone, but they haven't been stimulated to actually become bone yet. Or there's stem cells in your skin that they're just hanging around as going to be skin, but until you're injured, they're not skin yet. So you have stem cells throughout your body. And when you become injured, so let's say you cut your skin, for example, you bleed, and in that blood you have platelets. Platelets serve to first clot, so you don't just keep bleeding and bleeding, but then they actually work as signaling molecule or signaling cells to call in growth factors and call in stem cells both locally. So they call in the skin stem cells, and they also call in stem cells from your blood to come and heal the area. So I like to view platelets as kind of the general contractors and the stem cells as the worker bees. So you cut your skin, you clotted, then over time you form a scab, and under that scab, all those the platelets have called in the growth factors and the stem cells, and they're busy doing their worker bee thing, trying to regrow the skin. So over time, the scab falls off, and then you have, a scar, but it's skin tissue. And even over time, that if you're looking at it, that scar kind of looks better and better and more like your natural skin. And so that's exactly what we're doing with regenerative medicine, is stimulating that. It's called a healing cascade. We're stimulating that healing or inflammatory cascade in your body by injecting the platelets or injecting the stem cells. So we're using your body's natural healing abilities in a super concentrated method to heal itself. So the reason you don't heal like joints and ligaments and tendons well is because we have a poor blood supply. So if I'm sticking a needle right into like that meniscus tear, I'm essentially forcing a blood supply into an area that doesn't have one. And I'm also doing it at a much higher concentration than even if you had a blood supply, you would do anyhow, because we take a lot of blood and we take a lot of stem cells and concentrate them down. So when we're injecting it, it's at a much higher rate than you could do on your own, no matter what.
Talk a little bit
that
about,
make sense?
Yeah, it definitely gives your body some extra support. How are stem cells being used, say, like with other conditions beyond musculoskeletal?
I mean, I can speak to what I do in my practice. So I do them musculoskeletally, and I also do them with aesthetics. So again, same process of either taking your platelets or your stem cells. We can inject them into your face or microneedle it into your face. And what that does is stimulates collagen production. So we're stimulating, again, we're making a kind of a micro injury into your skin to regrow tissue and stimulate collagen. And so that would just give you a more youthful appearance. So it's going to help regrow skin. So you don't have to have an injury for that. Obviously, that's just kind of more for vanity, but also with the stem cells, if we're using your body's own fat, we're actually replacing lost fat as you age. So as we get older, from an aesthetic standpoint, our bone actually gets smaller. We lose fat pockets in our face, and then our skin starts to sag. A, because we don't have as much tissue in our face, and B, because there's less collagen and elasticity in our skin. So you can use regenerative medicine to stimulate collagen and elastin so that your skin is actually tighter, but also to like structurally replace some of the lost fat. So I do that as well in my office. It's also being used for things like erectile dysfunction or for vaginal rejuvenation as women age and go through menopause, lose their hormones. Their labia can become atrophied and sex can become painful. So you could inject platelets or stem cells to, again, regrow that tissue and plump up that tissue so sexual intercourse is not so painful. I know that they're using it in neurology and also in cardiology. I can't speak to exactly what they're doing with that because I don't do it. So I don't spend a lot of time researching that, but it's been around in the dental field for longer than anywhere. So there's lots of different fields of medicine that are using it, and it's becoming more and more popular because it's effective.
Yeah, I mean, I've even heard within the gut microbiome space, they're using stem cells.
Yeah. I mean, it's fascinating to me. It's fascinating, and it's, the reason for stem cells, if we understand just a little bit of physiology, I mean, as we get older, around, let's just say 35 to 40, the amount of stem cells that you have in your body significantly takes a nosedive, right? So if you notice it, depending on your age or the age of our listeners, really you start noticing that things affect you more. If you cut yourself, it takes a lot longer to heal. If you have an injury of any sort, it takes longer to heal. You notice, if you are dehydrated, you feel those effects a lot more. And that's partially because we don't have as much stem cells. We don't have as much natural healing ability throughout our body. Like we physically don't have the cells. And so that's part of the reason. I mean, hormones are another part of the reason. As we lose our hormones, I mean, they are very healing and help healing. Nutritional status, gut health, it all relates. I mean, as we get older, our gut health declines. and our ability to absorb nutrients properly declines. And so therefore our cellular physiologic processes can't do what they're supposed to for healing. And so it's really all related. I mean, it's not one thing or the other. When I have a regenerative medicine patient, we talk about gut health and we talk about hormones, and, not everybody wants my lecture about all of those things, but I at least give them like my 2-cent version as opposed to maybe my 25-cent version, because you need to hear it, because it's truly all related. You can't, though I could stick stem cells in your knee and delay your need for a knee replacement by 5 or 10 years, if you do nothing else to change your life, you're going to be back in my office, And so it really, the body is all very interconnected, and it's at least important to have a little bit of an understanding of that.
Talk a little bit about, aesthetic side of your practice in regenerative medicine. What does that mean when someone's getting aesthetic regenerative medicine, and what kind of like things do they come for on that front?
I mean, honestly, people mostly are coming for Botox in general, because that's just the most common, and that's not regenerative medicine at all. I mean, what Botox is botulinum toxin, and it's literally you're injecting it into muscles and causing you're weakening and or paralyzing the muscle so it can't move, and therefore decreasing wrinkles that way. So you're not stimulating any new growth of tissue. You're literally not able to move your muscle. And so you have less wrinkles, but it's not stimulating collagen. From a regenerative medicine standpoint, you can think of, if people know what fillers are hyaluronic acid. Typically there are other fillers as well. So from a regenerative standpoint, you're kind of working more on the filler front if you're doing stem cells. So again, if you're taking fat stem cells, that's the structural, it's a physical component that you can put into someone's under their skin and have, a more plump appearance of their skin. But the fat stem cells are also working to stimulate collagen. And, again, it's that cell signaling that's saying, hey, come here and rebuild the tissue. So you could do, the most common thing we do here from a regenerative medicine standpoint, that we do stem cells and we do kind of stem cell makeovers. Most people just want platelets, which is just taking your blood, concentrating out the platelets, and then we're doing like a topical application and micro needling it in. So the micro injuries of the needles is stimulating that inflammatory healing response, a cascade in your body, but also then the platelets are getting under there and again signaling growth factors to come and help regrow collagen. And that's really cool. Every time I do that procedure, even to myself, I get compliments like, wow, your skin looks amazing. And it does. It's really regrowing tissue. And I get asked all the time, how long does it last? And that's the thing. It's not a medication, or it's not something that's physically in your system and then leaves. It's stimulating that collagen and regrowing tissue. So that lasts, I don't know how to say anything other than forever. That doesn't go away. It's just we continue to age, right? So we're fighting aging, we're slowing the signs of aging is what we're doing with regenerative medicine aesthetically.
What do you find just in your space of regenerative medicine? What are common, things people should be aware of that's going on in the space? Like, is it a wild, wild west space? Is there like a tried and true way of doing things that you can go anywhere for regenerative medicine? What do you see as being some of the gaps that you're trying to bridge?
I think the gaps are, and obviously I'm going to come from a very biased standpoint, but I've been doing it for a long time. And so like I said, about 5 or 7 years ago, when all these companies started coming out with umbilical cells, that paved the way for people who are not well trained in this field to be doing it. And so it's hard because I think anybody can be trained to do anything and do it well. But I've seen people who just are selling like these stem cell packages or, stem cells. And because now they can buy them. So I'm not throwing any one person under the bus, because some people sure could be trained really well, but I do know some people have just kind of jumped on the bandwagon, and because they can buy stem cells now are saying that they can do all of these injections, when sure, the truth is anyone can be trained to do the injections, but they might not understand the cellular biology of it, and they might not actually be well trained in injections, right? I've been doing injections since my residency. In physical medicine and rehab, we do hundreds, if not thousands of injections on every body part before I leave. And so all knee injections are not created equally. I mean, when I'm doing a knee injection, I'm using ultrasound and I'm injecting directly into your area of injury, not just kind of generically sticking a needle into your knee joint. And while that will provide some relief, it's just not the same. And so when someone says, I mean, I've had a handful of people that come see me and we're talking about stem cells and they're like, oh, I've done stem cells and it didn't work. But in my mind, I'm like, well, did they inject with was it image guided, an ultrasound or a fluoroscope? Did they inject into the right area? What types of stem cells were they using? And so it is a little bit of the Wild West, because I think the gap is people really for these procedures should be seeing a physician who is trained in regenerative medicine. And there's plenty of physicians who are doing it additionally, again, because of umbilical cells, who I don't even think are well trained in doing it. So what I tell patients is ask the person who's doing it, if they know if they only offer you a purchased cell product like umbilical cells or exosomes or these things that are all out there, then I would go see someone who at least can offer you or talk to you about using your own bone marrow or your own fat. There is a time and a place to use a purchased product for sure. And I think I'm happy that they're out there and it can be offered to patients who maybe can't have the full stem cell procedure. But I don't think it's the end all be all. And I really think if someone is well trained in the actual extraction of the bone marrow or extraction of the fat, they are going to just have a lot more training in regenerative medicine and be able to really talk to when to use one product versus the other.
That's super helpful to know. Well, Dr. Quinn, where can people find out more about you, your work? Do you do consults or do you just work in Colorado?
I do just work in Colorado, though I do have patients that travel to see me from out of state. So I'm happy to do a telemedicine consult or just a phone visit. I've been doing that for a decade as well. And then, so if someone wants to see me for regenerative medicine, we could talk over the phone or over a telemedicine appointment. I could look at their imaging, we can have a conversation. And then, if they want to fly out here that way, we can help facilitate that and do the procedure that way. I have a website that's Core Medicine. It's KORE medicine.com. It talks about myself and all of the procedures and types of medicine that I offer. I've also developed a skincare line with a pharmacist, and I think you have the link for that, and that will be on the podcast. We're having a kind of a special since Mother's Day, and we're just going to keep it going for a few months of offering our daily 3-product skincare routine, which I love because I'm busy, I'm a mother, I'm an athlete, and I don't have patience for a long 20-minute skincare routine. So it's, 3 products of a vitamin C, a vitamin A, and a peptide that I think any busy person can put some quality skincare on their face and kind of slow the aging process that way.
Very awesome. Well, yeah, I'll definitely be putting in your link in the show notes, and just really pumped to talk about this topic, which has been, again, a very thrown around buzzword, regenerative medicine, understand what it means and how it can help our patients thrive.
Yeah, it's amazing. Thank you for having me.